All right, next step. So that was kind of an overview of Massachusetts. And if I keep talking, I'm going to bore myself. So, questions? Anyone want to ask questions about Massachusetts? Yes, ma'am.
Oh, sorry, not Massachusetts. More general.
Well, we'll have lots of time, but specifically, I want to make sure everyone understands, because this Massachusetts thing, it's an experiment. It is what they want to do in Washington. So I want to make sure everyone understands it. Go ahead.
In Massachusetts, most young people know they're immortal.
Correct.
So what happens to the ones, young, healthy people, the students or whatever, that don't get health care? They're not covered under their parents, and they're just students, or they're working, they don't want to pay for the insurance.
Well, Well, they by law, they have to buy it, or they get fined. Now, if they don't have an income, there's no way to track them, which is the fault in the system. It really can't make everyone buy insurance. But here's the thing. If you're 22 and healthy, and you want to buy one of these Cadillac policies that covers absolutely everything, you know, you're talking $6,000, $7,000 a year at a time where you're unlikely to need it. So what I do with my daughter's health insurance costs $30 a month. Why? Because it's a high deductible plan. If she gets hit in a car accident, she's responsible for the first $5,000, and everything else is covered. That's the way the law is written. There are actually firm caps. If you've got a high deductible plan, your out-of-pocket costs for the year are far less than if you have the traditional type of insurance. But the point is, she doesn't need someone to pay her day-to-day medical bills because she just doesn't have any. It's just a waste of money. So she covers, and that's what I always tell my young patients that are uninsured. I say, you know, go out and get a high deductible plan, $5,000, $10,000 deductible. We don't really care what it is. The odds of needing it are very, very small. But you just want it there just in case you have that car accident that yields $1 million medical bill. Because can I come up with $5,000 over 2 or 3 years? Yeah, I can pay that back. But can I come up with $1 million? No, it can't be done. So that's what the young people should be doing. But unfortunately, they want to, with this Washington plan, what they want to do is they're going to have one policy. It's going to have a masterful load of mandated benefits. It's going to be enormously expensive for these young people. So they're going to be forced to spend $1,000 a month for this insurance or pay 2.5% of their income as a tax for something that really is of no value to them whatsoever. Go ahead.
Did the number of doctors, physicians change after the bill was put in? In other words, did some leave the Commonwealth?
In Massachusetts?
Yes.
I don't know. I don't know the answer to that. But it didn't increase. But when something's free, people want more of it. So even if the supply of doctors was exactly the same, if the demand goes up, there's going to be, the waiting list has to go up.
What is your explanation for the increase in the premiums if you had younger buyers buying into the system? And secondly, what do you think went wrong with the Commonwealth Connector and why it was $18,000?
I can't answer the second one, but the tax laws are heavily skewed toward employment. For some reason, people just kind of stayed with what they have. Your first question was, why did the prices go up?
Yeah. Why do you think?
Because what happens is, when you demand everybody get insurance, the first year, the premium actually will go down. But because now everyone wants more services, the net amount that's spent goes up. And so the next year they have to raise the price because everybody's demanding more and more. Well, if you spend all that money, you're going to say, I'm spending all this money. I want something for my money. So you're going to say, I'm going to go out and get this MRI exam. I don't really need it, but darn it, I paid for it. And every year it just keeps going like that.
So, I'm sorry, off the top of your head, do you know if how much actual health care was consumed if the total dollar value in Massachusetts increased, like in years, did it step up? Now that everybody had become insured?
I can give you the total spending, but I don't know if that will answer your question. They anticipated $775 million in the first years. They actually spent $1 billion. And that's just one state, and that was 2 years. So they were that far off in their projections that quickly.
And that's because people were saying, I'm insured now, so let's go ahead and get this MRI.
Great. And, okay, so that's, okay, one more.
In Massachusetts, with their group coverage, if you needed a health care item that they didn't cover and you went out of state to get it, you could be arrested for a felony.
I didn't know that. If that's I don't know. that's in there.
If you get health care outside of your, say if Obama's plan passes,
Yeah,
and for the elderly, it says you can't get a hip replacement if you're over 70. So you go to a doctor, private doctor, and you say, I'll pay for it out of my pocket myself and bypass the plan. You and the doctor can be arrested for a felony.
except I don't know if that's the case. That is actually, what you've recited is actually Medicare law. So if you want your hip replacement and you know there's a line and you say, you know what, I want to get to the front of the line. Now there's not much of a line in this country. We're blessed. But let's say there was a little bit of a line, and we'll leave everything the same with how Medicare functions. You come up to me and say, hey, Dr. Kellen, I'll give you 50 extra bucks if you do my hip at first. Guess what? You go to jail. You cannot. You may not charge more than the Medicare amount, or it's a jailable offense. You know what's also a jailable offense? If you're required to pay a $20 copay for your office visit, and I waive it, that's fraud, and I go to jail for that too. So let's say you're having financial hard times, but because of the price-controlled system and the way it works, if I were to waive your copayment, that is actually something. I don't know of any doctor who's ever been put in jail for that. So try to be honest. But it is in the law that I could go to jail for that. All right, let me set this down.
I have one question.
Okay, go ahead.
When you mentioned the large deductible policies,
Yes.
I always thought that those were made very palatable by the fact that they could be combined with a medical savings account.
Correct.
Are
That's
they-
what I have.
Yeah, and then you really end up having no deductible, and you get some form of rationing in a way, because before I dig into $5,000 of my own money, I'm going to feel I need the treatment.
Right, and that's exactly what happens. If you're spending your own money, you're going to demand more. In my mind, nothing. Basically, they want to create the Medicare program for all. Actually, that was
And would that be a third program that they're
That's right.
creating?
Correct.
For medical coverage for
Yeah.
Americans that are supposed to be uninsured, so that would be the third program that's created?
Yeah, we'd have Medicare, Medicaid, and the public option. Actually, I had a nice video, but I don't think it would work here because my mobile laptop would be a little bit grainy. But there's a video showing Barney. Yeah, there's a video showing Barney Frank, one Democratic congresswoman from, I believe it's Illinois, here. And the president even saying that the easiest way to get a single-payer system is to get a public option in place. You know, Mr. Obama was on tape many times while he was in the Illinois Senate stating that his primary goal was he believed in a single-payer healthcare system. So this idea that this bill doesn't get you to single-payer, in about 5 to 10 years, is a complete myth. That's exactly what it's designed to do, and they know it.
One more question.
Yes.
I heard on some coverage also that if this bill was not passed and these policies were not seen to go through by the end of this year, that our taxes would be raised 2%. Do you know of any information about that?
If the bill did not go through?
Yeah, almost like a question mark.
Oh, I don't know. I can't comment on that one. I wouldn't, I mean, they don't, I'm sure they would like to raise taxes anytime they could, but I don't know of any specific connection.